Bariatric surgery is a scientific term for what we call actually a surgery for weight loss. What we usually do is minimal access bariatric surgery or laparoscopic surgery designed to help the patient lose weight. Pero ang weight loss surgery is not really the initial step on how we are treating patients for complications as a result of because of being heavy. Dito po sa The Medical City South Luzon, we approach problems regarding overweight comprehensively. At ang ginagawa natin po dito through our Wellness and Lifestyle Center as well as our Nutrition Management Service, we give the patients all the options and we give the patients the treatment first of all in terms of them being able to lose weight through non-surgical means muna. Ibig sabihin po, dinediet muna po natin ng mga patients, then we subject them to exercise and to even what we call as pharmacotherapy. We give them medications that will help them lose weight. If that fails, if all of the other means fail, and we find that the patient continuously has trouble functioning because of excess weight, sumasakit ang likod, sumasakit ang joints, nagkakaroon ng uncontrolled metabolic problems such as diabetes, for instance. If all else fails, this is when we advise our patient to undergo what is called bariatric surgery or weight loss surgery. So madalit salita po, it's an operation designed to help the patient lose weight para lahat ng simptomas that accompany being overweight. In medical terms, ang tawag po natin doon is yung morbid obesity. The studies usually show, and it has been our experience also, that within the first 6 months, as much as 30 to 50% of the body weight of the patient has been lost. So, malaking bagay po yon, especially for patients who are experiencing pain or metabolic issues as a result of being overweight. Malaking bagay po yon. Even for patients na meron tayong tinatawag na mga sleep apnea or because as a result of being overweight and they have very short and very large necks, nagkakaroon po ng hirap na matulog sa gabi. And that's a very dangerous condition, yung tinatawag po natin obstructive sleep apnea. Nare-resolva po yon as a result of about the 30 to 50% loss of weight in a period of say about 6 months. And they say that the studies would say, and perhaps our experience would also bear us out, na ang sabi nila that as high as 77 to about 80% of the excess weight, yung pong weight na labis or weight beyond the ideal body weight of the patient is actually lost within the first year of a successful and complication-free bariatric surgery. Let me say first of all that I'm speaking about bariatric surgery as not as an expert or someone who even does bariatric surgery, but I'm speaking as someone who has helped participate and design our comprehensive weight loss program, including bariatric surgery here at the Medical City South Luzon. In answer to your question, how long does the surgery last? A lot of it depends on, first of all, the condition of the patient, and of course, if the patient has been screened well before the procedure, mas mabilis po ang ating paggawa ng procedure. But it's not really the speed of the surgery that's important here. What is important is the safety of the surgery and the outcomes that we expect after the surgery. In the Medical City South Luzon po, we have surgeons and other allied specialists. We have endocrinologists, we have clinical nutritionists, we have our dietitians, we have our gastroenterologists, and all the other specialties that are allied, and they participate in preparing the patient so that the surgery will be safe, will be satisfactory for the patient, and the patient will feel good. In as far as the surgery is concerned po, alam niyo po, ang surgery kasi sa bariatrics is a complex type of surgery and it is performed by well-trained and well-credentialed surgeons, and we have surgeons in the Medical City South Luzon who do not only do these procedures at least once or twice a year, but these are surgeons who have dedicated their craft in performing these surgeries to the point that we can say that the number of surgeries that they do in a year qualify them as experts. At hindi lang po sila experts we can actually say, but that by the studies and by the data that we have studied as a result of their surgeries, that the patients are safe and they have actually achieved the desired result that they were looking for. We have our wellness center, and our wellness center is equipped with a unit which is called the Vivant Wellness Center. And in that center, we have clinical nutritionists, we have dietitians, we have endocrinologists, both for the young and the old. And we also have other allied specialists who are allowing us to manage patients even because of their joint pains as a result of being healthy. We have a dedicated nutrition management service. So for the patients who are supposed to be scheduled for, let's say, bariatric surgery, their diet plans are prepared way in advance so that when the patients come here, they not only are, kumbaga sabihin na po natin na sanay na yung katawan niya to a specific amount of food to be taken every day. And to add to that, we also have patients who are given counseling. Na po, yung pong mga patients natin, hindi lang nutritional counseling, but also counseling as regards how the changes of bariatric surgery will affect their moods and probably their whole attitude towards food and towards health and lifestyle. So all of these things po, I would like to invite all of you to check us out here in the Medical City, South Luzon. So we have the most comprehensive weight wellness center here in the south of Manila, and we are dedicated to safety, we are dedicated to excellence in outcomes. So I would like to ask all of you who are listening to come here and visit us in our Weight Wellness Center. And if you have any inquiries, I'm sure po that we will be providing you with numbers where you can, or other digital means by which you can actually ask your questions, so that we will be able to help you to surmount your problems as regards excessive weight. So thank you very much.